When I put my scrubs on this morning, it really hit me that this is my last day in the hospital in a clinical setting. I'm Sarah Kandani. I'm a fourth-year medical student at the University of Kentucky. Today's my last day in the hospital. I can't believe the moment's finally here, and it's just a very surreal feeling. I was actually born in Iran. I lived there for the first 10 years of my life. My mom's a very compassionate person, and I think I got that from her. A big part of why I wanted to do medicine was my dad is a physician, actually. My father was always a hero of mine, and he was a big inspiration for me. Ever since I was 5 years old, I wanted to be like him and follow in his footsteps.
I'm a Kentucky guy, born and raised. I love the different patient populations you can see in the state of Kentucky. So I'm Joseph McIntyre. I'm a second-year resident currently at the St. Elizabeth Family Medicine Residency Program. Through the UK College of Medicine, I was able to take care of patients in Lexington and Bowling Green. And now that I was able to match over here at St. Elizabeth Edgewood, I wanted to be in something where I could practice compassionate care, have a positive impact in people's lives. Medicine really takes both of the things that I wanted in a profession and ties them in together. Let's see what's on the schedule today. So today what we have on the schedule, I'll be in clinic about 8 to 12. We have a noon conference every day from 12 to 1 where we have didactics or lectures, and we'll have clinic until about 4:45 to 5. It's gonna be a busy day, but it's gonna be a good day.
It's 7:45 in the morning, and I'm here to start my rotation, and we are walking towards the abdominal CT and MRI room where we'll be reading images from 8 to 12. Let's go look at some CT scans.
Pretty normal.
Can you show me what it would look like on the T2 enhancement?
Yeah.
The last 4 years have been filled with such great education, very compassionate leaders, great mentors, and I think it has set an example for me. I think sometimes we don't realize how complex some specialties can be and what really goes on in a day-to-day life, which is what makes these rotations so good for us. Normal sized.
You know your stuff.
The state of Kentucky has given me so much. It's so exciting that I can give back a little bit and try to treat and help them with their day-to-day life. No matter where I go in the state of Kentucky, it's always home, because Kentucky's home. So I'm getting ready to see a patient, really coming in for a little bit of elevated blood pressure. I'm super thankful that the UK College of Medicine taught me how to be a compassionate and caring physician. That has really made the transition to residency a lot easier.
UK is the largest hospital in Kentucky, and it's a level 1 trauma center. So as a medical student, you really get to see everything that's happening that's so complex.
Especially here, like at UK, our patients are really sick and they're complicated. If you can read images at UK, you can read images anywhere.
So what was your first few days of residency like?
You're just starting off, you have a safety net. You already have a lot of experience to fall back on, and if there's something that you don't know, you always have your upper level residents, you always have your attending.
I don't think anybody ever prepares you 100% to be a resident. They always say medical school is like drinking through a fire hydrant. I would say residency is kind of times 2, but the UK College of Medicine really made that transition a lot easier. Right now I'm going to go check out to my attending, Dr. Daneman. With that A1C is 7.4. I'm going to see him back in 3 months.
Okay. Sounds good.
With family medicine, seeing all these different types of pathologies and patients, that's why I love it. You never know what you're going to get.
It's surreal that match day is only like 3-4 weeks away. It's a very bittersweet moment because I have loved these last 4 years at UK. I think I'm just excited to finally be in the role that I've worked my whole life for. I really have learned a lot these past 4 years.
Just got done talking to a few of the fourth-year medical students about match day, bringing up a lot of good memories from mine. Big question is there... I had so many physicians, and not only physicians, but people in healthcare that took time out of their busy schedules to really mentor me. I think it's not only my duty, but also my honor to kind of give back to the medical students. It's so exciting because you're really taking that next step in your journey where you're going to be a practicing physician.
I know that my family is just very proud of me, and I'm excited to finally be what I prepared for my whole life and kind of follow again in my dad's footsteps.
Residency and the education you get through the UK College of Medicine is going to prepare you for practicing in the future and becoming the best physician you could possibly be.
Match day is always such an exciting time for us. I remember back just not long ago, just a couple of years ago, when Dr. McIntyre matched. At that time, obviously knowing he was a stellar medical student and having high expectations, and he has met every expectation and beyond as a resident physician at St. Elizabeth.
The mentors that we've had and the faculty and the doctors that have guided me in the last 2 years and the teaching that they've done has prepared me so well for residency. I'm just so excited for the actual match day, to be on the field with my family, my friends, and just to see the excitement on everyone's faces.
It all comes down to today.
I'm really proud of her. She deserves it. She worked really hard. It's an exciting day, but we're really nervous.
Oh, we love her so much! We love her so much!
3, 2, 1.
You will never forget this day in your life. This was the day that you found out where you're going to be practicing medicine.
That was her first choice.
So excited!
You have hearkened the calling of service to your fellow human beings. This is the culmination of your dreams.